Dr. Daya, thanks for joining us here on Health Connection. Our topic is atrial fibrillation, AFib. It's when your heart goes pitty-pat and it's not a good thing. We like to start Health Connection segments off with a definition. What is atrial fibrillation?
Atrial fibrillation is a condition of the heart wherein the heart beats irregularly due to uncoordinated contractions that originates in the top chambers of the heart.
And what causes it?
Typically, there is no single identifiable cause that would initiate it, as much as there are risks of a patient's particular condition that puts you at an elevated chance of getting this irregular heart rhythm.
How do you know if you have atrial fibrillation, if you truly have the condition? Are there specific symptoms?
The symptoms are not specific to the disease. It's quite common that happens in other heart and lung related conditions, but there are some symptoms that are probably more prevalent in this condition than other heart conditions, namely irregular heart palpitation that you feel, and if it goes fast enough, you may get lightheaded, short of breath, and you may feel like as if you're going to pass out. On and off, you may have a condition wherein you feel more fatigued than usual, which may be related to the rapid heartbeat and the blood not getting pumped enough to meet the metabolic demands of the body.
How do you diagnose atrial fibrillation?
Atrial fibrillation is first thought of when the patient has these pitter-patter, irregular heartbeat symptoms and goes and sees a physician, such as a family physician, and then one takes a thorough, complete history followed by a physical examination when one can identify it when you look for the pulse, listen to the heart, and to confirm it, one would do more advanced testing, which would include an electrocardiogram, an echocardiogram, and sometimes it is the case that this condition may not be apparent at the time of examination. In that circumstance, we go and do a continuous monitoring of the heart, which may last anywhere from 24 to 48 hours, or on occasion you put in a monitor that you wear for over a month, and when you have those symptoms, you press a button to trigger the machine to record it.
Oh. Once you have a diagnosis, how do you treat it?
This condition causes three major complications. Because it's an irregular heartbeat, sometimes it can go fast, and the goal in that condition is to slow the heart rate down. And sometimes when it goes fast and it happens on and off, we can prevent it from coming on, and that time we use medications to prevent the irregular heart rhythm from coming back. The more devastating problem with this in a patient who suffers from this is the propensity to form clots in the top chambers of the heart. If this leaves the heart, they can go to the brain and cause stroke. In patients who have this condition, they are at a 5 to 7-fold higher risk of having a stroke compared to someone who does not have it.
I think you've answered this question. Is atrial fibrillation dangerous?
Absolutely. It is a condition where if someone has it, it needs to be looked at, examined and evaluated in a thorough fashion. And like I said, the two major consequences, including the stroke, and in some cases, if the heart irregularity and the speed is not controlled, over time the heart can go into exhaustion and then cause heart failure.
You mentioned this just a moment ago, but let's go over it one more time. What is the connection between atrial fibrillation and an increased risk for stroke?
Like I mentioned, it is best illustrated by looking at this heart model. Atrial fibrillation is a condition where the irregular heartbeat comes from the top chambers of the heart. In a regular heartbeat, the blood comes to the top chambers, goes down into the bottom chambers, then comes out to supply blood to through these major blood vessels to the rest of the body. When these top chambers on both the right and left side, they go into an irregular heart rhythm. They don't squeeze the blood like it should normally, and they start quivering. When that happens, the blood that is in the top chambers does not completely empty into the bottom chambers, and then some of the blood may be left pooling in here and cause clots. If the circumstances are right, this clot may leave and go to the bottom chamber and eventually through the major blood vessels and cause stroke if it goes into the brain.
Well, then can atrial fibrillation be prevented?
Well, we don't have any treatments to help prevent it. In certain cases, if someone has it, there is a chance that we can put the heart into a regular rhythm and not have the condition come back using medication. But it is difficult to identify if a particular patient, if it is difficult to anticipate if a particular patient is going to get it over time. And there is no preventative strategy specific to this particular condition as of now.
The future, what does it hold for treating patients with atrial fibrillation?
Well, going forward, the exciting new avenues now is in medications that will help prevent a person from having stroke. As it is commonly known, it is Coumadin or warfarin. And the new avenues right now are using medication in the form of tablets that you take without having the need to monitor as to how thin the blood is, and not have any interaction with food substances, which is a major concern for patients who take Coumadin. And also the technology to identify some of the reasons as to why this comes on is being evolved, and in certain circumstances, in the right patient, one can have a procedure called ablation, wherein they go into the heart through catheters and try to see if we can prevent this rhythm from coming back in someone who already has it.
Very well, doctor, learned a lot. Thank you very much for your time.
Thank you very much.